exactly, but I got once I got thrown out, I was able to get back in to record everything that you set up until the time I got thrown out, but that takes a while to process. So that's all recorded. I just missed the section where I wasn't here. So here we are.
I'll got the quick update was I'll send Haley a list of sort of some of the organizations that and their abbreviations. And then if folks like, I can sign them up for it's free for the e-news for Vision Serve Alliance, which talks about a lot of the things. And then Eileen was asking a question about our conference, which is in Kansas City, and we call it an open source conference, and anybody is welcome. You do not have to be connected to one of our agencies or any agency. Someone can just come as an individual. And I was saying we usually get about 350 people for that conference. So I'll launch into, so those are some of the things that are happening, right? So the AVLNC Coalition does a lot under those four categories. Public awareness, we write articles that we circulate on many of our organizations' website, as well as the National Coalition on Aging, the National NCOA, that's right, the NCOA, and then there's the ALNC, right, another alphabet soup, but it's the division of the American Council for the Blind that's specifically American Council of the Blind that's specifically designed for aging. So in addition to our membership websites, our website, we write articles for those specific places. We're just about to get something put out on the American Healthcare Association's website related to vision rehabilitation services that would be offered, that could be offered or for training that's allowed in senior assisted living or skilled nursing home facilities. So that's just some of the work that we do related to aging in the public awareness. Access to services. Again, there's a constant ad campaign that goes on through Mississippi State University. It's called Time to Be Bold that we worked with that identifies the vision rehabilitation services that are available for seniors. Mississippi State keeps track of that. They're responsible for a lot of the older blind funding and resources out of there. So they keep track of that for us. As for the AVLNC, as far as the research and data component, there is OIB has it's called OIB Tech, and if you look up OIB Tech in Google, it will take you to a repository of all the research that comes out through all the journals that is related to vision rehabilitation services, just period. It doesn't even have to be for seniors. Those articles that come out are peer reviewed by a couple of PhD researchers in the field that volunteer their time. They peer review the articles and they make determinations of what articles are available. So it is a huge resource repository for research that has been done at the university level, that if someone is advocating for particular services and services increase, they can pull the resources from there and put them forward. So this kind of combination of things that all was created by AVLNC with partnership with Mississippi State that is now available electronically has been really valuable to folks in the field. So because it's one repository of peer-reviewed articles. Another thing that came out of this was something that Vision Serve Alliance took up, which is also available on the website, which is called the Big Data Project. And the Big Data Project simply took to doing a deep analysis of the data by the census and the Center for Disease Control. So they did, the CDC and the census has a lot of data about visual disabilities, who has them, what they are what they're related to. So a researcher, some of you may know of him, his name is John Cruz. John Cruz did a very, very large cross-section analysis of the CDC data and of the census data and put them together to actually break down state by state, and believe it or not, county by county in each state, how many people with vision loss are living in the state, how many comorbidities they have, what those comorbidities are, so sort of what their income level is, what their minority status is, if they have a minority status, all of that data. And he put it together in a state by state and then county by county way. So we actually kind of have a count of all the people based on the 2020 census and the 2020 research out of the CDC of how many people are living with vision loss in the United States, and where they are, and what's the nature of their vision loss and other aspects of their lives. For those, what's very popular now, of course, we all know, is our social determinants of health. And vision loss really does play into that. Having vision loss is a factor in many other factors, in life that can cause struggle, right? It's a combination of that. We have a higher incidence of many things related, many other things that occur in the population that has vision loss. So that speaks to our research and data. Our policy influences are the work that we're trying to do out of that to really affect change. So there's been a lot of lobbying that's been done on the state level to increase older blind funding, or to increase funding with the aging, with other aging networks, like, statewide Department of Aging's, things of that nature, to start considering vision rehabilitation as part of that process, because so many seniors are living with vision loss. So there's been advocacy there. There's also a large project that's in the beginning stage that I'm responsible for with VSA that's called the Medicare Exploration Project. And in this project, we are seeking to make determinations of whether or not certain disciplines, 3 disciplines that are ACVREP certified, orientation and mobility specialists being one of them, if those disciplines can be used to expand vision rehabilitation services under the healthcare system, right? So we're exploring that possibility to see if in fact those disciplines can be used in addition to some of the disciplines, very few of them, frankly, that already exist. It's a very similar model to, if you're familiar with the Veterans Administration. The Veterans Administration uses ACVREP as a certifying body for the specialists that they call, just within the VA, a BROS, which is a blind outpatient rehabilitation specialist. So the BROS in the VA system that provide a tremendous amount of vision rehabilitation services are ACVREP certified in one of the 3 disciplines that we're also advocating for. We're advocating for a couple of other things under that model. We're going with a philosophy that high tide lifts all boats. We are talking about the research in that big data project really identifies, we're talking about 4 to 5 million seniors over age 65 living with vision loss. We're talking about 8 million adults between the age of 14 and 64 living with vision loss, and a couple of million kids. So when we add up all those services, we're at about 12, 13 million. That seems to be the common number that everyone agrees upon for the entire population right now of people living with vision loss. That's not a refraction error. That can be corrected with with standard glasses. But that's not legally blind. That extends down into vision impaired, just non-correctable, or obviously we're paying attention to the degrees in the visual field as well. So let me pause there and see if there are any questions related to that and those services and the things that we're trying to do for seniors.
I guess, is there any data as far as if the services are provided? I mean, it seems like within orientation and mobility, especially, there's such a lack of service getting out to even our students within the schools. So I mean, what is the system for providing for services, especially O&M for the seniors? Have you any data on that?
Yeah, no specific data points, but it's really a terrific question. It sort of gets lumped into sort of the whole discussion of a dearth of services, right, for the population. What I know from my vantage point in researching some of this and then just providing so much of these services is, you know, there are sort of places where some of the disciplines, right, kind of come in and out and cross each other. But the orientation and mobility as a discipline is the one universal discipline across what I call all sort of three places where I see different services happening. And I'm going to answer a little bit more deeply, Eileen, but I will recognize that what I might say next, you know, might be considered a little controversial, but it's really just a reflection of what I see from my vantage point. When the folks are younger, outside of orientation and mobility, and that's why I'll tie that in a minute. Outside of orientation and mobility, the vast majority of their sort of independent living services outside of that are really provided a lot by their TVIs in school, right? Braille instruction might be done that way. What in my old days I used to call keyboarding skills would be done that way, right? Other IL skills, organizational skills, large print labeling, you know, identifying certain things, all those kind of things. A lot of that is done, technology skills, use of a handheld device or a CCTV. A lot of that is done by the TVIs in the school system. When we get into our vocational rehab ages, you know, let's say 18 and above or 22 and above, you know, depending on what your state is, a lot of those services start to get provided by our traditional VRTs in the agencies like I mentioned, right? So if you're 40 years old and you're still working and you lose vision due to something, you know, a lot of those services are going to be provided by VRTs. When it comes the time for the seniors to get the services, if they could get them, and they get connected to an agency, they might get some of those services from the same VRT. But now there's more occupational therapists that are providing the services, and there's some low vision doctors, optometrists, and ophthalmologists that engage occupational therapists and manage to get some Medicare billing for that. Under certain traditional occupational therapy codes in Medicare for rehabilitation services in general. So there's a lot of that. I say that to say the area of vision rehabilitation where those services aren't done by someone else or don't shift as you move through the life cycle is orientation and mobility. We have orientation and mobility specialists in the school. We have orientation and mobility specialists in our agencies, and they from the agencies serve both the adult population and the senior population. There is no way to get an orientation and mobility service, you know, any other way except from an orientation and mobility specialist. So the shortage exists is the answer to the question, and it exists pretty severely. So there are efforts to increase you know, people participating in the disciplines in school, so they can continue, you know, to provide them. I haven't seen those efforts really move the needle a lot, but I've certainly seen them, you know, at work. I'm painfully aware from what I hear and how difficult it is for any agency that's providing service to have orientation and mobility specialists, to find them, to hire them. You know, and then obviously once they're hired, they are kept very, very busy. But there's a real shortage. It's a tremendous problem. It's one of the problems that we work on. And this specialty isn't one that other disciplines kind of share or change with the life cycle. You folks are needed from, you know, I don't know, from birth to death. That sounds morbid. You know, I don't know, from you know, I don't know, cradle to grave, I don't know, womb to tomb, I don't know. But it's a real concern. I imagine it concerns all of you in the discipline as well, how to grow the discipline and the amount of work that is available that you can't get to. Other thoughts or ideas or questions? I'm always happy to talk.
One, Lucas, one piece of or cup of alphabet soup that I haven't heard mentioned, but may have been mentioned in my unfortunate disappearance, was AARP, which, when you look on their website at services and interests, I haven't done a complete survey, but it's certainly not on their splash page or anywhere immediately below that. And I would think that from a pressure point of view, from an advocacy standpoint, they would be deep pockets and an obvious choice. But I'm sure there's rationales for why they're not there. They must be a tough nut to crack in some ways.
So, I get nervous when calls are recorded and this part of the conversation comes up.
I could have another accident.
No, right? No, it's okay. It's okay. I'll stand by everything I say. My understanding here is that many local organizations, state organizations have approached their local chapters, and many of the national organizations have approached nationally. And although it is not blatantly said, the message that comes back from AARP is that they're really not interested in promoting healthcare beyond curable conditions, right? They certainly don't phrase it that way, but they're sort of very interested in advocating for seniors to have, like, access to more healthcare or access to more medications. But when it comes to engaging in discussions that identify as someone, and forgive my language here, but someone living with a chronic disability, in their sort of way of perceiving it, they're not very interested in talking about that or promoting that. And the feedback that we've gotten really off the record on things like this is because that's not part of the vitality, youthful, energetic, enjoying retired life image that they like to project to their members.
Wow.
So that's when push has come to shove, that's the feedback that we've gotten.
Wow is right.
That's very interesting, because you think that they would see that niche and kind of want to jump into it. So the fact that that's kind of holding them back because it's a feeling of perception, we want to be perceived as this, that's kind of disheartening.
I mean, if we just think about, and this is now I'm purely an anecdotal, but when I heard that, I started to look around, not at AARP, and then I'll wind this up, but just think about if you've had like an advertisement, right? I live in Florida, so I get these advertisements, and we took over my in-laws' house when they passed. So I get advertisements all the time, right? For senior centers, assisted living centers that are popping up all over the place for people to live in. And in all of those centers, people look fairly young, right? For seniors. I mean, I've been in a lot of those centers. They look very energetic. They're picking flowers, they're laughing, they're at a concert, right? And they're not they're not using a wheelchair or a walker, right? Or not dressed to the nines, right? I mean, they don't advertise in the way if people are living with such great vitality, they usually don't go into assisted living or go into skilled nursing care, right? So it's this very tricky thing that I think senior organizations struggle with. Now that's anecdotal, but that's just a little bit of what I noticed when we got some of this feedback from AARP. If anyone on this call has a connection in AARP that they think is more open than what I'm suggesting, this would be me begging for you to share it with me, and I will follow up on it tastefully and kindly, because we would love them as a partner.
Sure.
It's a great question, Lucas. It really is. It's one of my big frustrations.
How we spent a lot of time here at OMSA on these calls and from coming at it from a variety of angles, talking about the production of O&M specialists as well as other subspecialties within the blindness field, but in particular O&M, because that's what we do.
We do, yeah.
But and I'm wondering if university programs, first of all, are members of Vision Serve Alliance, and secondly, I know that you mentioned that you're talking about the production shortage, and I'm wondering, which we certainly notice as well, especially in relation to the snake swallowing the basketball problem that
Mhm.
that we're talking about here. Do you see any solutions? Have you come up with any recommendations? Where are you with this? Where's Vision Serve Alliance on this point?
Yeah, it's a great question. I wish I had a better answer. We do work with like ACVREP on some of these things. They seem to be pretty active in analyzing all the university programs and in trying to sort of increase the amount of folks that can go in. We have certainly supported any effort that has come our way. There have been there's a group called the Item Coalition, which we're members of, which is a group that supports lots of government efforts to increase the amount of specialties in the field and the amount of sort of coverage that happens and things related to that. We support those things. There are frequently letters that are written that we sign on for things of that nature. But I wish there was more. We do interact with some of the schools, but not many of the schools are members of VSA. They are all welcome to be members of VSA. If people on the call are active in some of their alumni programs and what have you, and think it would be valuable, I'll do the same thing. I'll invite everyone to reach out to me and share, and I could contact the program and talk about what we do. We could create an affinity group if we had administrators that were trying to do things related to that. I wouldn't want to duplicate efforts. There are some efforts at, again, ACVREP, and I know AER knows about those efforts to try and increase the amount of people that are in programs that get certifications, what have you. So it's something that we support, but we don't have a lot of members that are university-based programs. But we have supported and provided information for some funding opportunities that came from some of our funders to try to increase programming. I know a funder did SALUS, used to be the Pennsylvania School of Optometry, but SALUS University got some funding to try and expand their programs, and there are a few others at some of the schools you all might know better than me. That's a good question. We need more O&Ms in the field. I'm preaching to the choir. We truly am. We lost someone, which makes me think that we're at time. So I just hit my clock and I see 8:01. So any other thoughts before we wind up? I really appreciated the opportunity to talk with you all. I hope I didn't lecture too much here.
No. Well, I hope at some point we might be able to do some collaboration too with the Vision Serve Alliance and be more visible among your membership. As far as what our efforts are, we're a small membership organization, but we're growing every month and want to make sure we address the needs of the elderly as well as the youth and those in rehab.
I would absolutely positively welcome it in any way that you feel like you'd like to collaborate. I mean, we can offer for you to give a webinar to agencies if you would like. I can offer for you to for someone here to write an article that we can put in our e-news, about the particular topic, a combination of those two things. Really anything. So it's terrific, Eileen. I'd be happy. It's not a plug for membership. I would be happy just to set up any type of collaboration. We know it's an issue, and we're very interested in expanding the services that blind and vision impaired people can get, and that means expanding the professionals that can work with them. That's the bottom line. If we don't have people to train them, if I didn't have people to train me to cross the street, it would be a whole different endeavor than the way I cross the street now. I'm very good listening to traffic patterns, thanks to you guys. So made a huge difference in my life and multi-lane crossings.
Good. Well, thank you.
I want to
Thank
do
you
a
so
bit of
much.
I'm sorry, go ahead. I want to do a quick bit of advertising, Jason. This is a
Please.
pamphlet that's available on our
Yep, the
on
what now?
our-
Yep, I've seen that.
right, and it's customizable on the back. This one we made for New Jersey. It's got the local the state
Yep.
agency as well as a couple of agencies below that to make people aware of. It makes
Yep.
people aware of the professions broadly and services that they provide. And it's targeted at optometrists and ophthalmologists so that they can give people the information along with perhaps unfortunate diagnoses. So yeah,
Mhm. So Luke, if you wish, you know, and you want to send me an email about it, I can certainly forward that and put you in connection. I have a lot of connection with like the SUNY College of Optometry, and I lecture there for their exiting seniors. They're exiting graduate school seniors, I guess. I don't know what word to use. And can certainly talk about it as something that they could provide, you know, as they launch themselves into practice.
I'd be happy to help you with that. And I'm in New Jersey, so I'm not far away, so I could certainly help with that as well.
Yeah, that'd be wonderful. Excellent. I'd be happy to. So just email me afterwards, and we'll you know we'll spark the connection.
Will do. Super. Thanks.
That's great. Yeah, great.
All right. Well, I'll thank you all again. I wish you all a good. I think you call this Mobility Monday, right? So I wish you all a
Right.
happy Mobility Monday.
Thanks. Thanks,
You as
Jason.
well.
You're welcome.
Really appreciated the presentation. That was amazing.
No, my pleasure. Enjoy the holidays.
Thanks, Haley, for organizing
you
that.
have
That
them.
was great.
Yeah, thanks,
Of
Haley.
course, happy to.
Thanks,
Okay.
Lucas.
Take care, everybody.
Have a
Bye.
great holiday, everybody.
Yeah. Bye-bye.